Hi, I am Vladimir Basul and I am going to report about heartburn and urinary frequency. So, what is heartburn in pregnancy? Heartburn is a symptom commonly experienced by pregnant women, such that some women and obstetricians even consider it to be a normal occurrence in a healthy pregnancy. So, who gets heartburn in pregnancy? Heartburn is a common complaint during pregnancy affecting 40 to 80% of pregnant women. Who is more likely to get heartburn in pregnancy? Increasing gestational age, the presence of symptoms prior to pregnancy, and multiparity or multiple previous pregnancies are reported risk factors. Increasing maternal age seems to have a protective effect. Why does heartburn occur in pregnancy? Several reasons for the increased incidence of heartburn during pregnancy have been put forward. This includes influence of increased circulating levels of progesterone and estrogen mediating relaxation of the sphincter that sits between the esophagus and stomach. The lower esophagus sphincter, the increasing abdominal pressure with the growing uterus, and the abnormal gastric emptying and changes in gut motility. So, what is the treatments that are available for heartburn in pregnancy? So, the treatment of any condition occurring during pregnancy is complicated by the need to avoid treatments that may be harmful to the fetus. The treatment of heartburn is no exception. Lifestyle modifications and dietary changes recommended prior to medical treatments. Next is we have antacids. Antacids are drugs which act to lower the acidity of the stomach. They should be trialed before the use of other medications and have the advantage that they provide almost immediate relief from heartburn symptoms. Next is the histamine 2 receptor antagonist. This class of drugs are the most commonly used drugs for the treatment of heartburn in pregnancy. This decrease the amount of acid produced by the acid producing cells or the parietal cells of the stomach. Next is we have the proton pump inhibitors. While proton pump inhibitors are considered the most effective drugs to control heartburn symptoms, data surrounding their efficacy and safety in pregnancy is limited. This decreases gastric acid production, but by a different mechanism compared to the histamine 2 receptor antagonist. Next is we are going to tackle about the urinary frequency. Increased urinary frequency is an early symptom of pregnancy in women. It's caused by an increase of the hormones progesterone and human chorionic gonadotropin. The urges tend to reduce in the second trimester. The uterus is also higher in the second trimester. Next is we have the causes and symptoms and also the treatment of urinary frequency. So from morning sickness to back pain, there are many new symptoms that come with pregnancy. Another symptom is the seemingly never-ending urge to urinate. Even if you've just gone a few minutes prior, pregnancy increases your urge to urinate. This can keep you up at night, especially during your third trimester. So the causes of this is the increased urinary frequency, which is a symptom, an early symptom of pregnancy in women. This results in less pressure on your bladder. Next is we have the rising hormones. Your body's fluid levels start to increase during pregnancy. This means your kidneys have to work extra hard to flush the extra fluid. The amount of urine you release will increase as well. In the third trimester, your baby's growing size means they're pressing even more on your bladder. As a result, you may have to wake up several times during the night to urinate. You also may experience increased urgency to urinate due to the added pressure. Next is we have the symptoms. So if you are experiencing urinary frequency in pregnancy, you'll feel the need to urinate more often. Sometimes you may go to the bathroom but urinate very little, if at all. Some women may also experience urinary leakage while pregnant. This leakage may occur when you cough, exercise, laugh, and sneeze. It's important to note that sometimes urinary frequency symptoms can indicate an underlying urinary tract infection. Women are more likely to experience UTI during pregnancy. In addition to symptoms of urinary frequency or urgency, other UTI symptoms include urine that appears cloudy, urine that is red, pink, or concentrated, urine that has a strong or foul smell, or a burning sensation when urinating, and pain when urinating. If you have these symptoms, immediately tell the doctor, and untreated UTI could progress up the urinary tract and cause more serious symptoms. Next is the treatments. One of the treatments is to perform Kegels exercise daily. We have to tighten the muscles of your pelvic floor by imagining you are stopping the flow of urine. Next is it hold the muscles for 10 seconds or as long as you can. Next is it releases the contracted muscles, and great for 10 minutes to complete a single set. Next is drinking enough fluid is vital to maintaining your health and your baby's health while pregnant. You shouldn't cut back on what you're drinking just to reduce your trips to bathroom. Your doctor may recommend strengthening your bladder muscles through exercises known as Kegels, which is mentioned earlier. Next is pregnancy-related urinary frequency and urgency usually resolve after you give birth. These symptoms will often subside about 6 weeks after giving birth. So that's all for today. Thank you for listening. Goodbye.